Okay, so why don't you introduce yourself and get started?
Okay, cool. So, starting. Yeah, ready? All right. Hi, everyone. My name is Dan. And then,
I'm Henry. I'm a third-year physical therapy student.
or we both are. Over the last summer, we were able to stay here and work with a lot of the participants. And then we went over a study of just like how this wellness program was benefiting people who are participating and how that affected them functionally. So just for some background info, so with the community wellness program, we were primarily working with an older adult population. So with that, aging is associated with a lot of chronic diseases, specifically like cardiovascular disease, which is causing over 20.5 million global deaths, and it also affects 128 million US adults. So with that, there's evidence that shows that cardiac or community wellness reduces mortality and improves quality of life. With that, though, participation is low. So the national participation in these programs range from 19% to 34%. And over 40% of these participants actually have a recurring cardiac event within 5 years.
So the purpose of our study was to assess the functional changes in the domains of endurance, balance, and strength, and we evaluated that at initial 4 and 12 weeks out. And so this was also the main goal, is to look at how a student-run and volunteer-run community-based phase 3 cardiovascular or community wellness rehabilitation program affects these variables. And our hypothesis was that in all the areas of balance, strength, and endurance, we would see an improvement at 4 and 12 weeks. So a little bit more about the structure of the study. To be included in the study, you would have to be a community dwelling older adult, and you need a physician referral for phase 3 cardiovascular rehabilitation. You would be excluded from the study if you use an assisted device like a single point cane or a walker. If you had a resting systolic blood pressure of over 250 millimeters of mercury and a diastolic blood pressure of 150 millimeters of mercury, or if there was a scheduled surgery in the future. So how this study went was we collected data, like I said, at initial 4 weeks and 12 weeks out. There were 6 tests covering endurance, balance, and strength. And each of these tests were performed with 5 minutes of rest in between each one. And they were also randomly, the order of the tests were randomly selected each session. So starting with the endurance test, we have the 6-minute walk test. It's basically just walking up and down a hallway that was 100 feet in length as many times as possible for 6 minutes. The 3-minute step test was stepping up and down on a step that was 12 feet in height. 12 inches in height for 3 minutes. And that was recorded. We recorded how many steps were done in the 3 minutes total. Next are the strength tests. We had a 30-second chair rise test or sit to stands, basically standing up and sitting down as many times as you can in 30 seconds. Arms had to be crossed to not use any extra support, and you had to make contact with the chair on every rep. We also use something called a handheld dynamometer to measure quad strength. Basically, it's a device that just reads force. So we put it in between the knee and the ankle on subjects, and they basically just kicked as hard as they could into it for 3 seconds. And then for balance, we had the timed up and go test. There's a chair and a cone about 3 meters apart. You stand up, walk to the cone, walk back, and sit down. Basically just evaluates walking direction changes and balance. And then we have the 10-meter walk test. Pretty much what it sounds like. You walk 10 meters and we time it and we get a speed for that.
So with that, here are some of the results. So for this table right here, this is mainly for just the demographics. So these are the averages of our participants. So average age being around 74, and mainly majority being more female than male. Everything else was pretty average in there, just taking like their demographics. And then this is the data we collected over the summer. So in that first column, we have the initial visit. Visit 2 is the 4 weeks out, and then the third column being the final at 12 weeks. You can see there are 4 numbers bolded on there. So we have the 6-minute walk test right here. That's measured in meters. So what the bolded means is that it was based on the stats, it was significant. So there was a meaningful change in there. So there was with the 6-minute walk test in endurance, and then also there was a significant change within the quad strength over the visits.
Something noteworthy to mention is we have the column on the right, the MCID. That's just the amount of change that has been found in literature that is meaningful to participants. And so we can see that a lot of the domains didn't really change to that degree, except for the 6-minute walk test. So that one, we can expect kind of a more noticeable change for everyone who participated in the study.
And then there's two that are NA'd, mainly just because there's not enough standardization yet, based on those tests. And then here are some of so all that data putting into a little nice picture so you can get a visualization. So for our endurance test, we have in the dark green, we have the 6-minute walk test, and in the lighter green, we have the 3-minute step test. So both of those, even though like the 3-minute step test has that sharp increase and then a little bit of decrease, overall, there's still an increase from the initial baseline at that first column. The 6-minute walk test is measured in meters, so that's going to be on the left vertical axis. And then the amount of steps is going to be on that right vertical axis. So overall, we can see that there was an increase from baseline. More so the entirety of throughout the entire study, though, the 6-minute walk test was significant throughout the entirety of it. Here's our strength. So basically the difference between absolute and relative. Absolute was just kind of like the value we got once we did the force test. And then relative was the amount of force taken into account the participant's body weight. But overall still really similar. So we just we tested left and right, but we just used one value. And then same thing with that. You can tell from the left to the right, from baseline to 4 weeks to 12 weeks, that was all a significant increase.
Yeah, one thing to note is that actually the significance, there was no statistical significance by the 4 weeks, but we reached that by the 12-week mark. So it just takes a little bit longer for those strength adaptations to occur.
Yeah. And based on literature, that's totally normal. It takes about 6 to 8 weeks to see noticeable change. And then the last of the tests, we have the balance test. So in the dark green, we have that 10-meter walks test that we measure in what we call gait speed. And then the timed up and go in the lighter green. So you can tell that the gait speed increased from baseline. And then for the timed up and go, it's on a downward trend, but that's good because going from start to finish, you would want to be faster as we progress throughout that. And then we can also have on the left, for gait speed, we have it measured in meters per second. And on the right, we have the time in seconds.
Did you do this at sand?
Yeah, we didn't. That one was also not super
So you don't have a chart?
it's in the table too.
Mhm.
But
the
you
reps
have
we
a
have.
slide of it.
We didn't have a slide of it.
Yeah, it was on here. So we have initial visit about 9 seconds, and then from visit 2,
30 seconds.
Yeah.
instead.
or sorry, 36.
So we saw an increase in those reps of we got around on average for the first visit was 13, and it increased to about 14 and a half. But we would need that 3 rise to make it like a meaningful difference. And we, in terms of significance, we were just shy at around like 0.06. So we were right there. But I mean, definitely more research is needed in terms of all these testing as well.
And so the bottom one is your strength measurement, like 5.
Yes, that's
There weren't any norms for that, obviously.
no. And we kind of found one for the absolute quad strength, but that was also based on there weren't too many studies on that in terms of a general population. It was pretty much people with COPD or knee arthritis. So not a whole lot of data in terms of norms for that.
Again, what significant changes were that you found?
Yeah, we found significant changes in cardiovascular endurance at both 4 weeks and 12 weeks of participation in the community wellness program. And then we also saw adaptations in strength by 12 weeks. So nothing by 4 weeks, which is pretty standard for the time it takes for musculoskeletal strengthening and adaptations.
And then I had another question. For the step test, were they allowed to hold on to anything, or was she stepping without holding on?
They were allowed to put their hands on the front and side wall, but no, like not holding onto a bar. Yeah,
Yeah.
but they weren't allowed to like put use one of our shoulders as a support, but we were there to guard just in case too. Yeah.
And the balance, there's no differences in the balance.
So yeah, there was no increase in the balance, but it was maintained, which I think is a win. We're actually gonna cover that in a little bit. You go to the
Yeah.
discussion.
Question.
Yeah.
So if they couldn't do the step at all, then, and then when they retried, maybe they still couldn't do the step at all, or maybe they could do one step. Is that kind of how you get that step up? I'm thinking that might have been hard for a lot of people.
It was, yeah, that was probably the most challenging one. What we did was usually if they couldn't do it on the first one, we just didn't have them do it for the rest of the trials for continuity's sake. Yeah.
Yeah. And then 12 inches is pretty high, but that was just the standard in the literature.
Yeah. So the main findings was that on average, these subjects attended the community wellness program around twice a week. But we didn't have data on what classes they attended or what interventions were used. And then we did notice that, like I said, there were significant changes in endurance and strength, namely at 4 and 12 weeks for endurance and then 12 weeks for strength. And then, like I said, the balance did not decrease over the 12 weeks. So, I mean, with older adults, it gets harder and harder to make those adaptations in terms of like endurance, strength, balance. And so typically, like what we don't want to see is just any decrease. So if it's maintained or getting better, that's kind of like a win in our book. And then, like I said, with like the 30-second sit to stand, there were other increases in the tests that were not statistically significant, but that were just on the cusp. So we can maybe see some improvements with those as a result of cardiovascular, the community wellness program, but more research needs to be done.
All right. And then this first column up top kind of gives like our normative data. So it's kind of like our reference point to see where like people are starting, how the changes occur, and it just gives us kind of like a target as well. So within that, the timed up and go, gait speed, and the sit to stands were all within the normative data. The only one that was a little bit below that kind of gave us like an idea of like endurance deficiencies was the 6-minute walk test. But by the end of the 12 weeks, the average was well above the normative, about normal. Yeah.
Normative data on these for 80-year-olds?
We did it based on 7-year-olds because that was the average of the entire population. Yeah. So these are all based on these are all based on 70-year-old adults. Yeah.
And then kind of just referring again to the balance. So it wasn't a significant change, but it was maintained well within the normative data. And then with that, the balance normative data kind of gives us an idea of like if they're not meeting this cutoff score, then there's like some fall risk associated with that.
So I think that's an important finding because, you know, when you look at the results for the balance, we would have liked to see results for the balance that was statistically improved over the 12-week period. But we didn't have individuals at baseline that really showed a balance impairment. They were really not indicative of fall risk, and the mean scores, the average scores at baseline for the participants were actually not really indicative of a balance impairment. And that might have been one reason why we didn't see significant improvements in the balance, because people already started off at a higher level. That was different for your 6-minute walk test, where actually people started off less than the normative values. And I think the participation over the 12 weeks potentially got them to improve to a greater degree with their endurance compared to with their balance. That was an interesting finding.
What did they do to challenge themselves to improve?
So that's the whole thing, right? We didn't really keep a track over the 12 weeks on a formalized intervention, right? We wanted to keep the study pragmatic in that, you know, when it's pragmatic, we look to see, you know, with regular routine activity that people are doing through attendance in the different sessions, you know, on the treadmill, what are we pragmatically seeing over a period of 12 weeks? So we didn't really control and specify the intervention. And I think that's part two of the data. Today was just to collect what are the improvements we would potentially see over 12 weeks without standardizing the protocol. If we standardize the protocol, we potentially could see more improvements than what we saw today.
Okay, so just some, here's like the main takeaways, is that participation in the community wellness program was that there was no adverse effects, like, the endurance, the strength both increased, and we saw maintenance and balance. Nothing went down from baseline, which is great. And then the other thing is that because we didn't really track, the specific classes and interventions that were done, is that would be great for future research, but also, it's kind of just like a tip. If you go to the exercise classes and you do the same amount every time, you're probably going to maintain whatever baseline you had. So the goal is to just do a little bit more each week. Doesn't have to be a whole lot, but just slowly increasing, just 1% better every week. And you can start to see some of those kind of increases in both that strength, endurance, and balance domains that we're looking for. Anything else you really want to add?
I think that kind of ties everything.
I missed a lot of your presentation. I'm sorry.
It's
I
mostly the
wrote it
methods,
down.
it's okay.
But I wanted to open up for additional questions that you might have. I mean, you guys participated in what specific questions do you have with respect to the data, or is there something you want more clarification on that I could speak to?
I think that your next dream would be good to hear about. What do you want to do after this?
Well, I think we haven't analyzed all the data. That's number one. I mean, if for those of you who participated, we took heart rate, blood pressure, perceived exertion responses with a lot of these tests, and we haven't even looked at that data. So I want to really understand what happened to your blood pressure. How did the blood pressure change over the 12 weeks? Were there changes in responses with these activities over the 12-week period? And that has not even, we haven't even looked at that data yet. I mean, I haven't even looked at that data yet. So that's another whole aspect of the data that I still feel we need to explore. That's one. The other thing is, I feel, we had a pretty good sample. I think, about 30 people. How many people was it that completed all 38? 38.
Mhm.
So for 38 people who completed all 3 sessions, I think it would be really nice to really understand how these people differed at baseline. Were there some with more of an endurance problem? Were there some with more of a balance problem? And then trying to understand these patients uniquely would be a little more insightful as to, how did these people with more of a balance impairment respond over the 12 weeks compared to people with less of a balance impairment versus somebody who had more of an endurance impairment. How did they respond over the course of 12 weeks compared to those who had less or more of that problem? So I think that was one of your suggestions, correct? So I think we can kind of look at that a little more.
And going back to Sharon's question, are there normative data for 80-year-olds?
In terms of 6-minute walk distances, yes, absolutely. So we have normative data for hexagenarians, septuagenarians, octogenarians, and there are community dwelling individuals, these are community dwelling octogenarians, and we do have normative data. But the reason what they presented was based on the mean age of the sample, which was 74 years.
I know I've tried to look up stuff, for 80-year-olds and 75-year-olds, and there's just for strength data for even basal metabolic rate. It's hard to find
It is.
data on
It
older
is.
adults.
And, there's a lot of variables that go into it. But again, we're looking at, it's population based. So I think 6-minute walk test, we've got the best idea. We've got the best ideas on the 6-minute walk test. But I wanted to go back a few slides, go to the MDCs or MCIDs so people understand. So when we try to look at looking at your results compared to what is really to understand, is that change that we're seeing meaningful? We kind of look at what people have published as what is meaningful change. So certain researchers have looked at a certain amount of change and documented that change, if they see that change, that correlates with some other factor that's meaningful in their life. And we know from previous data for older adults in the age of about 70, in the 70 mean age group, if you improve your walk speed scores by 0.13 meters per second, that is actually meaningful to people who are in their 70s. And we want to look to see, does this sample really hit that threshold? Is it, over the 12 weeks, are we seeing a 0.13 increase in the gait speed? And yeah, we don't. We don't see it. We see a little more increase, but we don't see that threshold there. But when you look at the 6-minute walk distance, we do see a 50-meter, we do see that 50-meter increase, which is really significant, right? We see that your baseline values is close to what the population scores are reported as the baseline value. And we see that 50-meter increase, which I think is really meaningful in the context of this patient, that you are through participation in the classes and on the treadmill, you are able to, on an average, improve your 6-minute walk distances. The same things with the strength. I think, especially as we age, sometimes strength is more important than endurance. Sometimes strength is more important. Strength and balance are actually much more important than, how much you can walk. And so to show statistical improvements in your strength, I think can be very meaningful in the context of what is going on in this program.
So, sorry, David, I think our next study should be just people have to be at least 80 to participate. That could be an awesome sample.
It could,
Yeah, I think you could really add to the literature. I mean,
yeah,
that's why I think it's so great you guys did this.
Uh,
Because
I think that's wonderful.
there's so little research being
Yeah.
done on.
Yeah.
They do it up to 65 and then
Yeah.
it's like.
Yeah.
That nobody
Yeah.
fits after that.
And we can just
That's
do
so
an
great.
investigation, and that could be even, we could just pull out people that were 80, and we could do a sub-analysis. I don't know how many people over 80 participated in this, but we can start there. We can just look at a sub-analysis of people greater than 80 and just do a sub-analysis in that group and do the same statistics, but just on a smaller group. And see if, what are we seeing in 80-year-olds compared to in younger people. So I think that would be, I don't know how many people, do you guys know how many people were over?
Top of the head.
Yeah, so that's something we could potentially look at, because that would be really unique to look at. I think the most challenging thing to do would be to standardize the protocol over 12 weeks. That takes a lot of resources. It takes a lot of, to standardize the protocol and to monitor adherence and compliance with the protocol over 12 weeks is very challenging. And so it's a whole different level of research when you go into these longitudinal studies that focus over a long period of time with a stratified, with a strategic plan of intervention. So that's something that's much harder to do.
But we can at least go back and look at the people that you did, what they actually did.
And
do
I think
during
that's
the
a
time.
wonderful idea. I think we
Yeah.
could start there. We could really pull out just the 80-plus-year-olds, the octogenarians, and look at what is the impact of coming year in people that are greater than 80? What other questions do you have? Other thoughts that we could kind of look at? I think that's a great idea, because that's what this session is all about.
I have thoughts about where the population came from after the testing. Were they nursing homes? Were they here? Were they off the street?
No, there were people here. There
They
were
were-
these people, you guys.
Oh, it's among us.
You weren't
here yet, Leon.
You weren't here yet.
I've been everywhere. I can't understand.
But I'm here yet.
I know a little bit about variables on a tremendous task you undertook. But I'm thinking, as long as I'm here, I could give my experience. When did you start falling? When did you realize you were falling? And I would say to you right now, thank you for letting me know when I'm falling that I should pay attention to it. Because what I figure is like, oh, it's old age, I'll be okay. It's not a good thing. One of the gals who comes to our dance every Friday has a fall a week. Sometimes she comes with an arm in a sling, sometimes a bandage on her leg. She doesn't realize that something she's doing is making her fall. She's younger than I am, and she's falling all the time. And she has a cane, and she goes around with a cane, and it's just a toy to her. She doesn't use it. So I think somebody should tell her, stop trying to be young and race around. Go slowly, stop thinking that you can still do the same things that you do. So someone like that would be good for your study, be impress upon her that you're going too fast, slow down. Right?
I think that's really true. I mean, sometimes when people see objective numbers, and you make sense of that number and say, this number has been shown to really be predictive of you falling more or having this negative outcome, then it's more meaningful to that person in understanding what that number means in assigning you as an individual who is at a risk for falls, or as an individual who has risk for going back to the hospital, or as an individual who is at risk for bleeding, or whatever it may be. So sometimes collecting objective data can really not only be meaningful from a research perspective, but as you're saying, more important for the patient to really understand what that means to them in their daily life.
She needs to do Rolando's program.
Yeah.
Mhm.
And then speaking on that too, that's also something we try to do throughout the data collection process. Dr. Dias gave us some norms based on the tests that had different ages and genders. And so we would by the end of the 12 weeks, we tried to we'd like to have like a debrief and say, this is where you're at based on these norms. And here's if you're at fall risk, or here's if we need to work on maybe strength a little bit. And we try to have that conversation at the last visit too.
That's wonderful. That's great.
I would be curious to know, standpoint of what level of exercise were the participants when they began? So for instance, have they been part of the program for a year? Have they just began the program? Like that type of data, because I'd like to see, if they may remain steady, okay, we're in for 5 years and this is really kind of in the norm that they developed. Or have they just joined? And then now we're seeing, wow, what a great increase in the program benefits. I mean, I think that those are
Yeah.
the question marks I
We
have.
collected that data, right, Henry? The number of years, or did we not collect that data?
I think we did
number of
collect it in
years?
the demographic. Yeah.
To find it if we didn't
Yeah.
collect it. That's
Yeah.
not a hard thing to have.
Yeah. I know we didn't analyze that. I
I
think
think
that's
that
a
would be
very
interesting, I
fair
think.
question, and I think we collected it. We did not, we didn't control for that variable, let's say. I mean, you would have to control for that variable in the statistical analyses. And we did not control for that in the statistical analyses. So I think that would have to be something that would have to be controlled for as a variable.
All right, yeah, great, thank you.
And the other thing you could look at is frequencies. So you did 38 people, and at the start of those 38 people, they let tug. How many of them were at risk based on their tug score? Was it the whole group? Was it half of them? Was it 2 of them? And how over time what percentage of your group improved their fall risk, because, but if you knew what you started, if they all were at risk for falling initially and half of them got better, that's a good meaningful thing. Versus if none of them were at risk for falling to start with,
Mhm.
then it doesn't matter so much that they didn't get better because they weren't at risk to begin with anyway.
Yeah.
I think something else that would be cool to look at is maybe like how many of the balance classes did they go to, or how many of any class did they go to, and track which
Mhm.
ones they went to, because that could really change.
Do we
some of the
have that
data.
data, Linda?
Yes.
We have the
Now,
number
let's
of,
go to the door and pick it out, but we can pick that up. You can track of all that.
we can track that. Because I think that might be a useful for each variable, as you're saying, to look at, to dichotomize, the group into two subgroups based on each variable. So if you look at the timed up and go score, based on the 13.5 seconds, who was at risk for fall versus who was at not risk for fall, put them into two groups. And then look based on the number of sessions and classes they attended, what were the differences over 12 weeks in those who were at risk for falls versus those who were not at risk for falls. And then we could do the same thing for the 6-minute walk distance, and we could do the same thing for gait speed. And, we could kind of look at each variable individually and look to see how participation in these activities could really be impactful.
I forgot, what was weighted to stand for?
Timed up and go. It's the test where you're sitting in a chair and then there's a cone
Oh,
3
okay.
meters away and you walk to it, walk back and sit
I
down.
was trying to figure out what the abbreviation was.
Really great thoughts. Thank you. Other thoughts, questions?
I had problems last year, and now I'm starting to come here and put more walking, but I wasn't. I was not holding my head up, and that's why I'm really trying to work on all the weights and
Posture.
just walking, with the head down and taking a shortcut. Now I'm like, it's, I don't know, you're just going, and I was getting a lot of bruising and doing some falls. It was just because not, like she was saying, you're just kind of going without standing up and arms back and head up, trying to see where I'm going instead of just not paying attention. I don't know, I think that, it's really important what you guys are doing to try to address this, but that is something too, that I think the weights and all that makes you more conscious.
These
Consciousness.
issues are multifactorial.
Yeah.
I mean, it could be, your posture, it could be,
Yeah, right.
what you're looking at and so I think
Actions.
there's so many, it's multifactorial and thinking about each person differently.
But it is a time in your life where you just have to stop trying to speed through everything, and not walk in the center of stuff. Just, interesting.
When you say posture, do you mean, do we have to remember to sit, stand? Because I noticed, she reminded me, sometimes I don't look in the mirror, but when I'm seeing my reflection in the window, I see that I'm slouched forward, and I'm concerned about that, because I gotta remember, and I don't know if I need to start coming to is there an exercise, or I just need to remember, stand straight, or?
I mean, upright is always preferential, but even I'm shrinking. So, yeah. Other thoughts, questions?
You did reflecting, but I'm hearing you, I wonder if for the participant, satisfaction level was I satisfied in my improvement, or emotionally, I guess I'm trying to attach that portion to it. And again, it's probably not maybe collected, but I'm curious about that.
Yeah. Do we have that data?
I don't think that was.
We didn't, I know we didn't collect it, but I think that's a very useful,
So
combination to the whole,
Those the
to,
activities
you know,
that come
to
from
that,
that.
So guys, tell us what you're off to Palm Springs to do what?
So basically this PowerPoint is condensed into a poster like the one back there. And then we're just gonna be in a hall and then people are gonna come through and ask like, what do we do? What do we find? And essentially present on like, not so much like to a panel.
Did you say which conference we're at?
Oh, no.
We're at the California Physical Therapy Association annual meeting. So we're gonna go there and present our findings. So it's like a exhibit hall. People come by, read the posters and ask us questions. And this is what we got.
And this is really wonderful because I'm not gonna be there. So Dan and Henry are gonna hold down the fort and they're gonna do a great job. So,
And is your department presenting any other posters or? are you
Yeah.
guys-
We got three
Yes,
left.
we are.
There's
Two more?
Two more, and
Yeah.
he's presenting
Well,
another one or two
I'm-
other ones?
He's a part of it.
I'm a part of the other one. I'll be presenting this one though.
Okay.
So what else is your class presenting?
I think one was an edit on concussion protocols. I think that was Dr. Moore and our department chair. And then there's also one based on like student board outcomes of the pro bono clinic we run downstairs. So it's just student opinions on how they feel that it's affected their development.
Well, I don't want to take up more of your time, so I just want to, number one, thank all of you who participated in the study. I think it was really impressive to see you guys come in and really, I know some of the tests were hard, especially the step test, as you
test.
heard. So thank you so much to whoever participated in the study. Thank you for your time and for your willingness to be a subject to collect data for the good of the program, as well as the good of science. So that was number one. Number two, thank you to Linda, who really allowed this to happen. I mean, Linda has been an advocate to really try to see how can we understand what's going on in the program a little better. So, her ideas and, her constant collaboration with us has really helped this happen. And number three, these two amazing guys who did all the data collection. I think I never showed up. So they actually took charge and did all of the data collection and just contacted me if there were questions. So, so it's been a great ride. We did submit the paper for publication and it did get accepted. So, this is going to be in a manuscript. We just have to make a few changes that I'm working on. So we're gonna get this information published, and it is open access journal. So we'll give you you can pull up the manuscript. It'll be available on the internet, open access. You don't have to have membership to an academy to read the journal. So that just got accepted. And I'm gonna continue to get more papers out of this because, as you know what they say in academia, right? Publish or perish. So we're gonna continue to keep up the good work and potentially do another study in the future. Linda, anything else?
No, that's good.
Great.
All right, thank you so much, guys. Appreciate your time. All right, thanks, guys. Good job.
Well, wanted to compliment them on the program. They're very organized and very
You're amazing.
encouraging.
Very good.
Thank you.
Thank
Thank you
you.
for
Thank you.
participating.
So there are people in here that weren't part of it, which is why you do have to have a next one in mind.
Yes.
Ron,
You can
right,
definitely
Ron,
make that happen.
Ron was here last summer. He's over 80, so yeah.
Actually, I forgot to acknowledge the college. The college did give us funds to help pay for the data collectors. So that was a big benefit. We used funds to pay for this. And it just gives us the data now to ask for more money.
Yes.
So now we have a manuscript and we have data to potentially do a follow-up, because without money, things don't happen.
You must be pretty well connected if you got that accepted already.
Yeah, 100%.
Yeah, that's impressive.
It's accepted tentatively.
That's still, that's.
Just so I'm working on.
I'm gonna stop sharing.
Yeah.
Look at my name.
All right, thank you. I gotta run to a faculty meeting. Thank you, guys. You guys are awesome. Thank you